Hello, I'm Michael Good, CEO of University of Utah Health, and presenting today the COVID-19 update for January 19th, 2021. At the national level, although we see the holiday variation through Thanksgiving and the Christmas holidays, and a recent down trend here, over several months, you can see the trend in new coronavirus cases in the nation has been increasing. Again, the last week or so, we've put together several days with a downtrend. We'll continue to watch that and hope that continues. Similarly, deaths in the United States rising at a very worrisome level. Again, with the Thanksgiving and the Christmas, both decline and then rebound. Maybe a leveling off in the last day or so, slightly lower. We had a couple of low days here. But again, worrisome trends at the national level with increasing cases and increasing deaths from coronavirus. A slightly different picture here in Utah, although for new cases, we see both the Thanksgiving dip and the Christmas dip followed by rebounds. And following the Christmas dip, we did see a pretty significant rebound here in Utah with a couple of days up over 4,000 new coronavirus cases. But as you can see, the downward trend is, there does appear, when you take out those holiday variations, tend to be a downward trend in probably about 7 to 10 days here with a significant drop. Again, we did have a 3-day holiday weekend this past weekend, and always have to wait a week or so to see if there were disruptions in testing, disruption in who came to get tested, and so on. Similarly, a little bit different picture with deaths in Utah, probably more of a stable pattern, again, with a couple of these holiday dips that we've seen in the other trends, but averaging somewhere between approximately, so a 10 on this chart again over the weekend. We had a few low days. We tracked also the Utah Department of Health, a little bit different pattern being seen in their trend between the two data sources, but certainly not that rapid rise that you're seeing across the nation. Again, we'll follow and hope these downward trends in both cases and deaths from coronavirus in Utah continue. So what that means is we've seen continued stabilization and decline in the number of active cases of coronavirus. We've been hovering just under this 1 out of 60 Utahns with an active coronavirus infection for quite a while now. This trend here traces back to the end of November, beginning of December. So about 6 weeks or so with a stable and slightly declining. In the inset, we show the United States, and obviously quite a different picture at the national level with a continued rapid rise in the number of active coronavirus cases in our country. The daily case count now shown in the orange line is a 7-day average, the gray line a 21-day average. Again, we've added the 21-day average because we have these holiday variations declining during the holiday period with a rebound after the holiday period ends. But as I showed you before, and then shown nicely here with the gray 21-day average, the 21-day average taking out some of that variation. And as you can see, declining quite nicely through this period and then stabilizing here for the last week or so, a little bit more than a week. So good trends in the state of Utah with new daily cases of coronavirus. The one trend in Utah that's not moving the correct direction is our hospitalization. These two charts, the green line shows the 7-day average of Utahns in a hospital with COVID-19, and the blue line shows the number of Utahns in an intensive care unit. And you can see that in the last couple of days, we've set new highs for both of these numbers. So our previous peaks had been back here in December. We're now up over 600 Utahns in a hospital with COVID-19. and just about matching our previous peak at about 220 in an ICU. We're going to have to watch this carefully. The hospitals are very full, and again, as we've talked many times before, we first see positive new cases, then we see the hospitalizations, and then lagging even further are the mortality, the unfortunate mortality from a coronavirus infection. So hospitalization at some of the highest levels we've seen in the pandemic. Our hope is that as the cases come down, so too would the hospitalizations. So we'll keep an eye on that and report back next week. Some encouraging signs, although again, disrupted by a long holiday weekend. But recall in our last few reports, we saw this very worrisome increase in the percent or the number of positive cases for each 100 tests, or the so-called positivity rate. And we had peaked over 30, gotten up to about 33%. So that means every 3 coronavirus tests that were administered, one of them was coming back positive. Over the last week, we've seen a pretty substantial decline from this 33 level now down into the 23, 22 range. We do have a holiday weekend in it. We do see variations both in the number of individuals tested and the number of positives during those holiday weekends. But we also are seeing more and more vaccine administered. And so, like all trends in the pandemic, we'll follow this, but it would be great to see the percentage of coronavirus tests that come back continue to decline. The reproductive number, again, the measure of how many individuals, each individual with a coronavirus infection, how many do they transmit, how many other individuals do they transmit the infection to, and whether you look at the instantaneous value or whether you look at the 7-day moving average, both are below 1. And that means that each person with a coronavirus infection is transmitting it to fewer than 1 individual. That's a really a good situation for our state. It means we're doing the things we need to be doing, not only getting vaccinated, but also the distancing, the masking, the hand washing. Cannot emphasize enough how important those are. And our state is moving into a good place right now, or a declining number of coronavirus infections. And this is as reflected in the reproductive number that is monitored and measured by Dr. Zhang and Dr. Seymour, and we appreciate their work. So I showed you the deaths from coronavirus in Utah stabilizing, and another way of seeing that is, again, although there is great day-to-day variation, somewhere around 9 or so Utahns each day dying from coronavirus, which is sad and unfortunate. And it means that coronavirus is killing Utahns at about the same rate of cancer. And as you can see, the 2 lines here, the cancer and the COVID-19, running about the same now for pretty much 2 to 2.5 weeks, as shown on this chart. I show you this, you saw the positivity rate, the percentage of coronavirus tests that come back positive. Pleased to see that decline in all age groups this week in our report. And I particularly call your attention to the 85-year-old group. Remember in our report last week, we were worried about this uptrend that I've shown on the chart. For the last week, we saw a reversal of that. And along with all of the other age groups, we're now seeing declines in the positivity rate. The 15 to 24-year-old group have resumed the highest positivity rate, followed by the 25 to 24-year-olds. Here at University of Utah Hospital, we've seen the same pattern, decline followed by rebound after Thanksgiving, decline followed by rebound after the Christmas holiday, and then for the last week or so, stabilization with the suggestion of an overall down rate. Recall the blue line that I've just drawn on is the 14-day sum of admissions to the hospital. And you can see that on most days now, we're receiving about 8 to 10, or we're admitting about 8 to 10 patients with coronavirus to University of Utah Hospital. What that means for our hospital census is, again, Thanksgiving dip, holiday dip, or Christmas holiday dip and rebound. And we're now hovering just a few patients under 60 active COVID-19 patients at University Hospital. And you can see we've resumed a more typical pattern that we've seen throughout the pandemic, with about 2/3 of the patients on the medical ward and 1/3 of the patients in the intensive care unit. Today marks the resumption of in-person learning at the University of Utah. So this was the snapshot at the end of last week as students began to return to campus. We do have an extensive return to campus testing program where students that live in the dormitories will be tested weekly during the spring semester. And we also will have a regular testing program, many student groups getting weekly testing, as well as availability for faculty and staff to be tested, even if they're asymptomatic during this spring semester. So recall that the number of new cases reported out of the 62,000 individuals who work at the University of Utah hovered in the 20 to 30 range during the fall semester. Again, with students off campus when this report was last updated, was a little bit lower as the students had not yet returned to campus. So we'll continue to watch the infection rate in our University of Utah campus community as the spring semester begins. We also now, from the Department of Health, Utah Department of Health website, keep track of the vaccinations that have been administered. And as you've seen, we've got just a little over 100, just under 154,000 individuals have received their first dose, just under 15,000 their second dose. And you can see continually ramping up of the vaccine program here in the in the state of Utah, and also here at University of Utah Health. We'll continue to provide updates on the vaccine as the state and the health systems work together to get the vaccine administered to as many individuals as quickly as possible. And finally, as we roll out the vaccine, actually the public health measures are more important now than ever. We know the vaccine greatly diminishes the likelihood of an individual who is infected with coronavirus from developing COVID-19, the illness that sends you home and a certain number of individuals to the hospital and even is fatal for a number of individuals. But what we don't know is, does the vaccine prevent somebody from having the virus infect them? They do not get COVID-19, but they still could spread it to another individual. So we've got to keep the face mask, hand washing, and physical distancing protocols and these activities continuing until we get wide numbers of individuals vaccinated. Remember, the lowest risk situation is when both an individual without a so-called carrier and an individual with coronavirus and an individual without are both wearing masks. Obviously, when you're sick, stay home, stay away from others. So that's our COVID-19 update for January 19th, 2021. We'll be back next week to provide an additional update where we hope to see these improving trends and the increased numbers of individuals vaccinated continue. Thank you.